Okay, hi. So now today we're covering emergency management. Now remember, this is the guidebook that I use for everything that we're doing. So grab yourself a copy of this and let's unpack the emergency management. Emergencies, they happen. They do happen sometimes. Now, look, we've got to prepare for emergencies all the time, particularly because we are in education and care service delivery. So we've got to make sure that we've got those foundations in place, those practices in place, those plans in place, that we are practicing them, that children are involved, that they are documented. So there's a whole range of things around emergency management that we need to be doing. Okay, so let's think about likely situations. So what is likely? Now you're in a household in family daycare. So what's likely? Most household fires are started by clothes dryers because the flint hasn't been cleared out. So a fire is likely. A non-custodial parent turning up is likely. Depending on where you are, is a snake likely? Is an intruder likely? So what is likely to happen at your residence, and what do you need to prepare for, and how do you prepare for something that hasn't happened yet? Okay, so firstly you've got to think about, well, okay, so what is likely? A house fire, that can happen to anybody, touch wood, that can happen to anybody, but if that were to happen, how would you deal with that? What would the children know what to do? How would that play out in reality? So with emergency management, the best thing to do is, once you decide your likelies, then you build on those scenarios and you think, okay, if somebody were to come in the front of the residence, where do I put the children? Do I put them in the kitchen cupboards? Do I run out the back door? Where do I put them? What is your escape route? If there were a fire in, like, let's just say from either the kitchen or the laundry, where would children escape from? What would happen? How would we practice this? Okay, so once you decide your likelihood, if you haven't used a risk matrix yet, a risk matrix is really interesting because you can say, okay, so what could happen? An intruder could happen, yes? So what is the likelihood of that? It's fairly low, isn't it? We know that it happens, and we know that home invasions are on the rise. We know that, but what's the likelihood? What's the risk? So the risk is probably minimal, but the damage could be catastrophic. So that's where you've got to work it out. So the likelihood might be low, but the risk is catastrophic. So if that should happen, then this is what you need to be prepared for, okay? Okay, there's no point in going through your risk management and those sorts of things without having a written plan on the wall. So one of the things, particularly in family daycare, that we often talk about with risk management is, as the educator, you're often by yourself. So what if something were to happen to you? What if you were to have a heart attack? What if something were to happen to you? How would those children that are still in your care, how would they get help? Who would respond? So that's in your planning. So when you do your plan, you need a grid of your residence and where the exit points are, all those sorts of things. Those exit points need to be clearly identifiable. So if you've got another adult there and you have a heart attack, that other adult can take control of those children and get those children out of harm's way. So you need to make sure that your exits are always clear of any kind of clutter or anything like that. So you need to be able to do that. What else is there? So we've got your thing up, and look, this is probably the most important thing, and I tell a story often when I do my classes around this, is with emergency management, we practiced a drill once when this was a long daycare service, but we practiced a drill once and we got everybody out. When we did the head count, we realised that there was a child missing. Now, this was just a drill, but this particular child had some individual needs, and what that child did was he went and hid, and it took us ages to find him. So we started to panic, of course, and it took us ages to find him. So once the commotion all erupted, once the emergency drill was put into place, this child didn't know what to do. So this child hid because he was obviously scared. He was obviously a whole range of things. So the learning from that was that if we practice all the time with children and we support children through this practice and we support children through emergency drills, then they're not likely to do that. Whereas if they're not practiced, if they're not rehearsed, if the children don't know what's going on, then children can be unpredictable, and sometimes children will run to danger, not realizing that obviously, so they'll run to danger rather than from danger. So by having that built into them, they know where to go. So when do you need to practice your emergency drills? At least every 3 months you need to practice them, and you need to document, well, what went well, what didn't go well, what would I change next time. You need to notify the parents. Make sure that if you do practice an emergency drill, that the parents of the children that are there on the day, that they are notified, because children can sometimes wake up in the middle of the night and go, oh, there was a fire at childcare today. And the parents are like, oh, what happened? So make sure you notify the families that it was an emergency drill and that there wasn't any real danger, that sort of stuff. So make sure when you are practicing drills, that particularly with new children or young children even, that they are practiced regularly, so that children there, do you remember when you did your studies about the synapses all joining together in the brain? By having that in their brain, then again, they're more likely to follow directions, they're more likely to follow the plan, they're more likely to remove themselves from danger. So when to practice a drill? Every 3 months anyway. If you have a new child enrolled, then once they're a little bit settled or a little bit familiar, then we would practice one, and we would say to that new child, this is what we're going to do, this is how we're going to do it. So we would support that child through that, and we would make sure that they're practiced. If you've got a child who maybe didn't behave or didn't act in the manner that you were hoping for during an emergency drill, then repeat it again, so that child builds those skills and can be a part of that, so that if anything does happen, that child knows what to do. So it's about rehearsing, it's about practicing, it's about making sure that all children have that practiced with them. So if you've got a new child, you would do it. If you haven't done it for a little while, or if a child has missed a drill, so say like you did a drill on a Tuesday, but that a child doesn't attend until a Wednesday, then the following one would be done on the Wednesday, so that child can be involved in it also. Make sure that you always maintain your registers of who's on the premises, or who, so that should anything go wrong and emergency services need to jump in and do anything, then those emergency services can find any people. So if you've had a heart attack but you've got a 16-year-old that lives with you, then the emergency services can look for that resident. If you've got a visitor on the property, the emergency services will look for that visitor if anything happens. So make sure that your registers are complete and everybody knows where everybody is and who everybody is. That's really important. So do your scenarios, practice your scenarios. Make sure children are involved in your scenarios. What is the likelihood of your scenarios? And they're the ones that you would practice most. We tend to practice fire more than anything, but fire may not be your biggest risk. A non-custodial parent may be your biggest risk. And I've dealt with non-custodial parents turning up at the door and going, oh my, this is my child, I want my child. And then we've got to deal with that. And that can be that can actually be a traumatic experience in the time between you call the police and those sorts of things. So that can be an emergency, and that can be very traumatic for children who witness that. If a parent's trying to push through the door, or it can be an ugly situation should that happen. Okay, so some tips for your emergency management. Again, everything that I've already said. Make sure your plans are in place. Make sure that parents know your plans. If you've got an educator assistant, that they know your plans and they are part of your drill. If you've got a visitor there, that they know what's going on. Your drills should be rehearsed at all different times. So when I was a practitioner, we used to do one drill per year where the children were eating, but again, we would have to have, that would have to be planned. So we would have some backup food, some sandwiches and those sorts of things ready. Because as an educator, if an emergency is going to happen, you want to plan for the worst possible time that it will happen. So what's the worst time that it could happen? When you've got everybody sitting down for a meal, or when you've got everybody sleeping. So how are you going to get sleeping children? And if you've got up to 7 children in your care, how are you going to get those sleeping children out of the house really quickly? So practicing those drills in times that are probably not ideal, although again, if a house fire is going to break out, we can't pick the time that it's going to happen. So what you need to keep available all the time. So you need to have a phone all the time so that you can contact emergency services, or families can contact you. So you've got to be contactable. So have your phone in your pocket or whatever that is. Make sure that your emergency kit is up to date. So you've just got a bag to take that should contain anything that you need. So if you've got young children, then you might have some nappies or some snacks. If you've got older children, you might just have water, snacks. You might even throw a colouring book in there in case you're sitting out the front waiting for emergency services for a half an hour or more. An emergency can take, once an emergency is alerted, you may not be able to enter that residence for another couple of hours, depending on what that emergency is. So something for the children to do. You need update contact details in your evacuation bag, so that if you do have to evacuate and go to the corner or those sorts of things, you can at least sit there and contact the parents and say, this is what's happened. Can you come and get your child? So you need updated contact information. You need a fully stocked, updated first aid kit. So make sure you keep your eye on that's fully stocked and updated. Updated. In case there is any kind of injury that you need to take care of and apply first aid to. So you would need, like your bandages, your ice pack, that sort of stuff. So make sure you've got a really good first aid kit that you can quickly take with you in your evacuation bag. Look, we've dealt with emergencies that children have been locked in the house. The educator has gone outside to maybe check letters or whatever, and the door is slammed shut and the children are locked inside. So think about what would happen if that were the case. Can you hide a key outside? Can you give a key to a neighbour? What could potentially happen, and how you can potentially protect children or access children really quickly or get them out, those sorts of things. Okay, now remember, this is, what was I going to say? No, lost my thought. I'll come back. Okay, so with your emergency management practices, have all of that in place as you go. Make sure all of your documentation is correct. Your contact details are up to date, all that sort of stuff. All right, now, one thing that is often missed in emergency management planning is near misses. So if you have a near miss, if you've had a child that's tripped over maybe you've got a garden edge and somebody's tripped over that garden edge 2 or 3 times, that's an accident waiting to happen. So a near miss is something that potentially could have gone to an accident. So you may have a fish tank or and you walk in the kitchen and you see your child's just about ready to jump into the fish tank or put their hand in or whatever, and you take that child and oh no, you can't touch that fish tank, oh yeah, and everything's fine, but that's a near miss. So if you have a near miss, make sure that you document those near misses and that you include those in your emergency management planning. So near misses are just an indication that something's wrong. So make sure you do that, make sure you update those. Now remember, there are fines in Australia related to this. So the fines in this book will indicate where the fines lie, and in emergency management and emergency management, there are fines that are related to that. So make sure that this is something that you are all over. If you need any help planning your emergency evacuation or conducting any drills or anything like that to do with your emergency management, there's some links here where you can get in touch. But make sure you grab this book. This will help you plan out your emergency management and get it all right so that you're safe and so that children are safe. We definitely don't want any children to come to harm, but I want to make sure that you as educators are safe and protected, because we don't want this to come back on you and we want to make sure that you've got all the right processes in place so that should something go wrong, you're protected. Okay. All right. So grab your copy of the book. If you need anything, the links are here. You can jump in and I can help you through anything at all that you're doing. But make sure you reflect on those emergency plans and make sure you practice them regularly and document what you see, because if you've got a child who, as I said earlier, may hide, or if whatever that is, or you might find that if you do a drill that your bag's not up to date, those sorts of things. So make sure you document all of that. All right. Okay. Good luck with your emergency management, and I will see you in the next one. See ya. Bye.